If you keep waking up at exactly 3 in the morning, your body might be trying to tell you something most people ignore. But before we get to that, because we will, later in this video, I want to tell you about something even stranger. A 71-year-old man walked into a dentist's office for a routine cleaning. Nothing unusual. He wasn't in pain. He felt fine. And yet, by the end of that appointment, the dentist had found early warning signs of heart disease. Not a cardiologist, not a blood test ordered by his primary care doctor, a dental hygienist looking at his gums. That's not a fluke, and it's not science fiction. It's something researchers have been documenting for years, and in the last 12 months, some of the biggest names in cardiology have doubled down on it. So if you've ever wondered why your dentist keeps asking about your heart, or why your doctor's office wants to know when you last had your teeth cleaned, stick with me. By the end of this video, you're going to look at your mouth completely differently. I'm Dr. Anthony. I've spent my career caring for older adults, and if there's one thing I've learned, it's that the body doesn't send warning signs in neat little packages. It sends them sideways. A twinge here, a symptom there, something that seems totally unrelated to the organ that's actually struggling. And nowhere is that more true than with your mouth and your heart. Today we're going to walk through exactly how your gums, your teeth, even your dentures can be quietly reflecting what's happening inside your cardiovascular system. We'll talk about the science, real studies, real numbers, nothing made up. We'll talk about dry mouth from medications many of you are probably taking right now. We'll talk about how a poorly fitting denture can chip away at your nutrition without you even noticing. And at the end, I'll give you a short list of simple things you can start doing this week, no matter your age, to protect both your smile and your heart. So get comfortable, maybe grab a cup of tea, and let's get into it. Let's start with the big one, because this is the heart of everything else we're going to talk about today, pun fully intended. Periodontal disease is the medical term for advanced gum disease. It's not just a little redness when you brush. It's a chronic infection that eats away at the tissue and bone holding your teeth in place. And according to the American Heart Association, it affects more than 40% of American adults over the age of 30. That's not a rare condition. That's nearly half of us. Now here's where it gets interesting. In late 2025, the American Heart Association released an updated scientific statement. This was published in their journal Circulation in December of 2025 that looked specifically at the relationship between periodontal disease and what's called atherosclerotic cardiovascular disease. That's just a formal way of describing the hardening and narrowing of your arteries from plaque buildup, the kind of thing that leads to heart attacks and strokes. This wasn't a small study. It was a synthesis of a large and growing body of research, including newer studies that use something called Mendelian randomization, essentially a method that helps researchers get closer to understanding cause and effect, not just coincidence. And what they found was striking. People with periodontal disease showed higher rates of coronary artery disease, heart attacks, stroke, and peripheral artery disease, which is when the arteries in your legs narrow. Beyond that, several studies they reviewed found that people with gum disease had thicker carotid arteries, that's the artery in your neck that supplies blood to your brain, along with stiffer arteries overall, and impaired function in the blood vessel lining. These are all early markers doctors look for when we're worried about someone's cardiovascular future. Now, I want to be honest with you here, because that's what you deserve. The researchers who wrote this statement were very clear that they have not proven gum disease directly causes heart disease. As of this update, published in Circulation in December 2025, they stated plainly that there is no confirmed direct causal link yet. What they have found is a strong and consistent association, and a set of biological reasons why that association makes sense. So let's talk about why. Here's the mechanism in plain language. When you have gum disease, the tissue around your teeth becomes inflamed and can even bleed. That creates a kind of open doorway. Bacteria that normally stay in your mouth can slip into your bloodstream through that inflamed, damaged tissue. Once they're in your bloodstream, they can travel, and in some cases, researchers have actually found oral bacteria embedded directly inside arterial plaque, the same fatty buildup that clogs arteries and leads to heart attacks. But even beyond the bacteria traveling directly, there's a second pathway that might be even more important, and that's chronic inflammation. Your immune system is built to respond to infection. When you have ongoing gum disease, your body is essentially fighting a low-grade chronic battle in your mouth, month after month, year after year. And that battle doesn't stay contained. It raises inflammatory markers throughout your entire body, things like C-reactive protein, which cardiologists already use as a warning sign for heart disease risk. The American Heart Association's own statement pointed to this as one of the most plausible explanations. Periodontal disease contributes to chronic inflammation, and that inflammation is one of the same processes driving artery damage. There's also a simpler piece of evidence that I think really brings this home for people, and it comes from something you already do every day, or maybe don't do as often as you should. The American Heart Association highlighted earlier research showing that people who brush their teeth less than once a day have roughly double the 10-year cardiovascular risk compared to people who brush 3 or more times a day. 13.7% risk versus about 7.3%. Now, brushing more doesn't magically protect your heart on its own, but it's a reflection of something deeper. Less plaque, less bacteria, less chronic inflammation, and a lower overall risk profile. And then there's flossing, which I know is nobody's favorite part of the day, but this one genuinely surprised even people in the field. In January of 2025, researchers presented findings at the American Stroke Association's International Stroke Conference. This was reported through the American Heart Association's newsroom, showing that people who flossed at least once a week had a 22% lower risk of ischemic stroke and a 44% lower risk of a specific type called cardioembolic stroke, which happens when a blood clot travels from the heart to the brain. They also found a 12% lower risk of atrial fibrillation, which is an irregular heartbeat that itself raises stroke risk. This research followed thousands of participants for 25 years. I do want to be transparent with you. The researchers themselves described these findings as preliminary, since they were presented as a research abstract before full peer-reviewed publication. But a quarter-century of follow-up data is not something to brush aside, if you'll forgive the pun. So when you put all of this together, the AHA's updated statement, the inflammation research, the flossing and stroke data, you start to see a mouth that isn't separate from the rest of you. It's connected, intimately. And that 71-year-old man I mentioned at the start, his dentist noticed significant gum inflammation and bleeding, flagged it as a possible cardiovascular concern, and referred him back to his physician for a closer look. That's exactly the kind of collaborative care the American Heart Association has been pushing dentists and doctors toward, especially for people who already have risk factors like high blood pressure or diabetes. Now let's shift to something that touches an enormous number of people watching this video, and it's one of those symptoms that feels minor until you understand what's actually going on. I'm talking about dry mouth, medically called xerostomia. Here's a number that might surprise you. According to the American Dental Association, dry mouth affects an estimated 30% of adults over 65, and that number climbs to as high as 40% in adults over 80. And the leading cause, in the vast majority of cases, isn't aging itself, it's medication. The ADA notes that people taking 1 or more daily medications are roughly twice as likely to experience dry mouth compared with people taking none, and the risk climbs even further once someone is on more than 4 daily prescriptions. Think about how common that is at this stage of life. Blood pressure medications, antidepressants, antihistamines, diuretics, medications for overactive bladder. The list of drugs that can reduce saliva production is very long. A study published in the journal Drugs and Aging looked specifically at drug-induced dry mouth in older adults and found it strongly tied to the number of medications someone takes, not just which specific one. Now, why does this matter for your heart conversation today? Saliva isn't just there to help you swallow your dinner. It plays a genuinely protective role in your mouth. It washes away food particles and bacteria, it neutralizes acids, and it helps control the population of bacteria living in your mouth. When saliva production drops, bacteria have an easier time building up, plaque forms more readily, and your risk of both cavities and gum disease goes up. So dry mouth isn't just an uncomfortable, annoying symptom. For a lot of people, it's quietly accelerating the very oral bacteria and inflammation problem we just spent the last several minutes discussing. A recent register-based study out of Sweden, published in 2025 in the journal Frontiers in Oral Health, looked at real prescription and diagnosis data for an entire regional population. They found that dry mouth was diagnosed in under 10% of adults age 18 to 35, but in over 41% of adults over 71. That's more than a 4-fold increase, and the researchers tied it very clearly to prescription medication use and the number of different medications someone was taking, what doctors call polypharmacy. If you're someone managing several prescriptions for your blood pressure, your cholesterol, your mood, or your joints, please don't panic. This isn't me telling you to stop your medications. That would be dangerous, and I'd never recommend it. What I am telling you is that dry mouth deserves to be mentioned to both your doctor and your dentist, not brushed off as a minor annoyance. There are things that can help: sugar-free lozenges, saliva substitutes, sipping water throughout the day, and sometimes simply adjusting the timing of a medication. Your dentist and doctor working together can often find a solution that doesn't compromise your treatment for other conditions. Now, I want to talk about something that I think gets far too little attention, and that's the relationship between how well your dentures fit and your overall nutrition, because this one has a surprisingly direct line back to cardiovascular health. There's a well-known study, originally published in the Journal of the American Dietetic Association, that used data from the Third National Health and Nutrition Examination Survey, a large, nationally representative U.S. health survey. Researchers compared people with natural teeth to denture wearers, and specifically compared people who felt their dentures fit well against those who felt their dentures fit poorly. The people with self-perceived ill-fitting dentures had measurably lower diet quality scores, ate fewer vegetables, had less variety in their diet overall, and had lower intake of vitamin C and carotenes, the nutrients found abundantly in fruits and vegetables. Interestingly, people with good-fitting dentures had diets that looked almost identical to people with their natural teeth. The problem wasn't dentures themselves, it was dentures that didn't fit properly anymore. This matters more than it might sound like at first, because dentures change shape over time, not because anything is wrong with them, but because the bone and gum tissue underneath naturally continue to shift and shrink as we age. A denture that fit perfectly 5 years ago may now be loose, may rub, may make chewing certain foods painful, or just not worth the effort. And so, understandably, people start avoiding foods that are harder to chew: a crisp apple, a piece of steak, raw vegetables, nuts. Foods, in other words, that happen to be some of the richest sources of fiber, potassium, and antioxidants, the exact nutrients that support healthy blood pressure and healthy arteries. A more recent study out of Japan, published in the journal Nutrients in 2020, followed community-dwelling older adults and found that denture wearing was associated with malnutrition risk, and specifically that complete denture wearers ate significantly less meat and fish compared to people wearing partial dentures or people with more of their natural teeth remaining. Fish, of course, is one of the foods most consistently linked in cardiovascular research to lower inflammation and better heart outcomes. So losing easy access to it isn't a small thing. So here's the ripple effect I want you to really sit with. A denture stops fitting well, chewing becomes uncomfortable, certain foods quietly disappear from the diet, nutrient intake for heart-protective vitamins and minerals declines, and inflammation and blood pressure control can suffer as a result. All of it starting from something as seemingly small as a denture that's a little loose. None of this happens overnight, and none of it is your fault. It's simply what happens naturally over years. But it's also completely fixable, and that's the good news. A denture adjustment, a reline, or a new set fitted properly can restore comfortable chewing. And comfortable chewing tends to bring those nutrient-rich foods right back into the diet. Let's step back for a moment. If you're watching this and you're in your 60s, 70s, or beyond, I don't want you to feel alarmed. I want you to feel informed, because that's a very different thing. What the research is really telling us is that your mouth is not some separate, disconnected part of your body that only matters when a tooth hurts. It's genuinely part of your cardiovascular story. Inflammation in your gums can echo through your bloodstream. Dry mouth from a medication you may need for a completely different reason can quietly change the bacterial balance in your mouth. And a denture that no longer fits can slowly steer your diet away from the very foods that protect your heart. So let's talk about what you can actually do about all of this, starting today. First, if you have gum disease, meaning bleeding gums, persistent bad breath, gums that look red or swollen, or teeth that feel a little loose, please don't dismiss it as a cosmetic issue. Get it evaluated by a dentist or periodontist. The American Heart Association's own recent statement specifically recommended that people with existing cardiovascular risk factors like high blood pressure, high cholesterol, or diabetes consider more regular dental screenings and targeted periodontal care, precisely because of this inflammation connection. Second, floss. I know, everyone's least favorite piece of advice. But given that 25-year study linking regular flossing to meaningfully lower stroke and atrial fibrillation risk, it takes less than 2 minutes a day and costs almost nothing. If traditional floss is difficult because of arthritis or dexterity issues, floss picks or a water flosser work just as well. The goal is disrupting that bacterial buildup between your teeth, not the specific tool you use. Third, if your mouth feels dry, especially if you're on multiple medications, mention it at your next appointment, to both your doctor and your dentist. Don't just live with it. Simple fixes like sugar-free xylitol gum or lozenges, Alcohol-free mouth rinses designed for dry mouth and consistent water intake throughout the day can meaningfully reduce the bacterial and cavity risk that comes along with reduced saliva. Fourth, if you wear dentures, pay attention to how they actually feel, not just whether they technically stay in place. Slipping, rubbing, soreness, or avoiding certain foods because chewing is uncomfortable are all signs it's time for a check and possibly an adjustment. Dentists generally recommend having denture fit reevaluated periodically, since your jawbone and gum tissue continue to change shape over the years, even after you've stopped growing new teeth, obviously. And fifth, keep your twice-a-year dental visits, even if nothing feels wrong. That routine cleaning is exactly how that 71-year-old man's story began. Dentists are increasingly trained to look for oral signs that may reflect broader cardiovascular risk, and that visit might genuinely be one of the more valuable checkups on your calendar, right alongside your physician and your cardiologist if you have one. I promised you at the start of this video that I'd be straight with you about the state of the science, so let me do that one more time before we close. Researchers have not proven that treating gum disease prevents heart attacks or strokes. The American Heart Association was explicit about this in their most recent statement. What exists right now is a strong, consistent, biologically plausible association, not confirmed proof of cause and effect. Large randomized controlled trials that would definitively answer whether periodontal treatment reduces cardiovascular events are still ongoing, or in many cases still needed. This is genuinely an active area of research, and I'd encourage you to think of everything in this video as a very good reason to take your oral health seriously, not as a guarantee that flossing alone will prevent a heart attack. Your blood pressure, your cholesterol, your activity level, and your overall diet still matter enormously, and none of what we covered today replaces any of that. If this video helped connect some dots for you, I'd really appreciate it if you hit subscribe. I put out videos like this every week, specifically built around research that affects adults over 50, explained the way I'd explain it to my own family, not the way it gets buried in a medical journal. And if you've got a topic you want me to dig into next, drop it in the comments. I read every one of them, and honestly, a lot of my best video ideas come directly from what you all are asking about. Before you go, take care of that mouth of yours. It's telling you more than you might think. And take care of that heart too. You've only got the one. I'll see you in the next video.